It's so encouraging and energizing to have the support of so many of our partners. Thank you to Mayor Ginther, Council President Hardin, County Commissioner Crawley, Board Member Michael Cole, Dr. Roberts, Kenny McDonald, and Mifflin Middle School parent Leo Carter, for standing alongside me today to talk about the importance of keeping our students in school, in their classrooms, as much as possible. I have said it countless times, while Columbus City Schools exist to serve our community, our families, and our students, we cannot do this important work alone. It takes an entire community, a city of partners, to come together, especially in critical times, to do what's best for kids. And what's best right now is being in person, in classrooms, to the greatest extent possible. Because we know that that's where students are safest. Our schools offer students so much of what they need to grow academically, socially, emotionally. And that's due to our outstanding educators, principals, support staff that we have in our school buildings. What's happening in Columbus right now is not unique to Columbus. It's happening all over the United States. Schools are grappling with the challenge of maintaining in-person learning in light of increased staff absences. Like many other districts, we have taken a daily assessment approach to make determinations building by building. Our process involves looking at the number of absences, the types of absences, and substitutes to cover in each school, starting in the afternoon, continuing in the evening, and early morning hours. This process has allowed us to safely have as many students possible in their classrooms for in-person learning. Over the 9 days that Columbus City Schools was in session the past 2 weeks, we averaged more than 100 schools open for in-person learning, available to serve more than 40,000 students in our city each day. In total, 41 of our 112 school buildings have had at least 1 day of remote learning over the past 2 weeks. The remaining 71 schools have held in-person learning each day. So despite the challenges we faced over the past 2 weeks, our entire district has stepped up every opportunity to support our students and our fellow staff members, whether that be covering classes, quick responses to maintenance issues, or delivering additional PPE materials for classrooms. We recognize the importance of being there for our fellow staff members and our CCS family. We want to be the beacon of resiliency and strength, and to show how to get through this pandemic together and prioritize our students. Because our students deserve to be in school. And I appreciate the efforts of our teachers, our principals, staff, and partners to make that happen. We will get through this critical time, but we must do it together as one city and one community. Thank you.
Good morning or good afternoon. And thank you, Dr. Dixon, for those words. I want to thank this partnership here between City Hall, the county, and so many others who are vehement about supporting our young people, our children, being in a school building. As a parent in Columbus City Schools for the last 15 years, of a graduate student in 2020 and a soon-to-be graduating student this year, I know that there is no more productive and safer place during the day than for our children to be in school, for our children to be learning and bringing in the curriculum and the teaching, the instruction that they need to grow into productive citizens. At the end of the day, we want to ensure that our staff are safe, that we have effective transportation working, that we have buildings that are safe, warm, and dry. And we have been vigilant to that effect. We have. I want to ensure that this partnership shows its strength and its bond and what our district calls the power of one, Dr. Dixon, the power of one. The power of one community coming together to ensure that what is best for our children is put into effect. I'm thankful again for this partnership. I look forward to our continued support of each other and moving forward this power of one in Columbus City Schools that makes us a place that makes each student highly educated, prepared for leadership and service, and empowered for success as citizens in the global community. God bless you.
Good morning. I'm Leo Carter. I'm a parent of a middle school child from Mifflin Middle School. And I stepped here today to give you guys my thoughts as far as why I feel it's very important for our kids to remain in school. Over this past year, my middle schooler spent all of his time in front of the laptop with his phone and also social media and things that's not educational for him. I was thrilled at the fact that you guys asked me to speak because of the fact that I was determined and happy at the fact that he was going back into the classroom this year because of the fact that he missed his interaction with his teachers, his peers. And I'm a firm believer that a lot of our kids' social outcomes or social outlooks are developed within the classroom, not on social media. That's not what's important for our kids. And a lot of our kids aren't learning what they need to learn from being remote because they don't have that personal interaction. They can't just stop and ask the teacher, well, I'm not understanding, can you help me? Can I stay after class and get some more? You know, that's being in that classroom and being able to get that extra, being able to ask the questions if you don't know. That's one of the big major things that my son and I go over. If you don't understand or you're not able to catch it, ask a question. Keep asking until you understand it. You can't do that if you're looking at that monitor and you can't speak directly to your educators. A lot of kids, I feel, that I've interacted with outside of school is actually their safe haven. Some children don't have it at home, that support system that's going to help them where they get answers to questions that parents unfortunately may not know. They can't get it directly from their parents. We need that classroom interaction. The staff at Mifflin Middle School have been so convenient for me as a parent. I've been able to go to the school and ask questions myself for things that my son don't understand, as far as if he's need to be in the classroom today, or is this going to be another school year where he's not able to attend class all year long. With that being said, I'm so grateful to our teachers, our administrators, for being willing and able to get into these classrooms, not knowing what's going to happen as far as the COVID is concerned. They have no clue how this is going to affect them in the long run, because most of our educators aren't doctors and epidemiologists. We got to learn, they just like us, learning from the experts. but at the same time, they still got to maintain and continue to teach our children who actually love and appreciates the guidance. A lot of them may not act like they like the guidance, but they do. They appreciate it. In the long run, we all wanted somebody to lead us in the right direction. And so with that being said, to Columbus Public Schools, Mayor Ginther, and all of those involved with educating my son, I'm grateful, and I hope that we can continue to keep them in the classroom. And with that, Mayor Ginther.
Thank you, Mr. Carter. Thank you. Pretty powerful, and that's why we wanted a parent to come. Mr. Carter and I realized we were both Dominion Middle School Blue Devils. We missed each other by a couple of years, but he went off to West and I to Whetstone, but we share that in common. I want to thank Dr. Dixon and Board Member Cole for your commitment to keeping our schools open, and for all the perspectives you're going to hear today. So regardless of your viewpoint on things, vaccines, political considerations, right, left, liberal, conservative, we all agree there are three things, right? Keep our kids in school, keep the economy open, don't overwhelm our health systems for our neighbors who are in need. We know the best way to do those three things is to get vaccinated, get your booster, wear a mask, especially indoors, keep our social distance when we can. I know we're all exhausted and tired and frustrated with this pandemic. It has been a tough one. Just ask a nurse or a doctor who have never, ever gotten a break. But our children have paid the highest price, suffering more than a year of remote learning. We know the toll it has taken on them, not just academically, but socially, mentally, and emotionally, as Mr. Carter spoke to. The Omicron variant has ramped up the number of cases, causing fear and uncertainty. But what we know is this: COVID-19 is here to stay. We must learn how to live with it. In the early days, almost 2 years ago, we knew little about the virus, and we had no way to prevent it or treat it. Now we know that masks prevent the spread of the virus, especially surgical masks. Now we have a vaccine and boosters to stave off the worst infections and keep people out of the hospital. And we have promising treatments for those who do catch COVID. We, as a community, have a responsibility to our children to continue in-person learning because school is safe. Keeping our children in school also allows parents to work, which keeps our economy running and growing. And we all have a duty to our healthcare workers, our families, and our neighbors to get the vaccine, which is our strongest tool in this battle against COVID. For this community, remain constant. Keep our schools open, keep our economy going and growing, and keep our hospital systems from being overwhelmed. We love our teachers. Some of the most important people in my life growing up in Columbus City Schools were our teachers. We know it's safe for our teachers. We advocated, those of us on the steps here, for our teachers to go to the front of the line when the vaccine was available so we could reopen our classrooms safely. We love and support our teachers and know how critically important they are, as are our bus drivers, our teaching assistants, those who work in food service, all critical components. And that's why we're here today. Our kids deserve our very best, even in the most trying of circumstances. And that's why we're so supportive of being in person for our young people. Now to talk about the public health impacts and the safety of in-person learning, Please welcome our great warrior in this battle, Dr. Mashika Roberts.
Thank you, Mayor. As the mayor said, the last 2 years of this pandemic have been very difficult on all of us. But our children have been hit particularly hard. They have faced unprecedented changes and hardships unknown to us when we were children. Isolation, lost time with family and friends, missed activities, and educational changes and challenges. And with these challenges have come growing mental health issues that have been exacerbated or maybe are just starting to debut as a result of this pandemic. As we move into our 3rd year of this pandemic, with unfortunately no end in sight, we must do what we can, what we're capable of, to provide children with the support, stability, and the tools they need to move through this pandemic. One of the best things we can do is keeping them in the classroom. Schools are essential. Kids belong in the classroom where they can learn, they can engage, and they can reach their maximum potential. We continue to know that kids should remain in the classroom with all the public health mitigation practices in place. And you heard the mayor say it. Masking for students, for teachers, for staff. Vaccines and boosters for all who are eligible. Staying home when you're sick. Washing your hands, enhanced cleaning of the schools, and social distancing when appropriate. Based on what we know today, transmission is occurring outside the classroom and in social settings. Transmission is not occurring in the classroom when all the public health mitigation efforts are in place. I applaud Columbus City Schools. If you remember, it was early August, if I'm not mistaken, maybe even July of 2021, when the state had dismissed all the orders for schools to mask in the classroom. And Columbus City Schools was the first school district in the state that said, we will mask when we go back into the classroom. So they have been following that important public health guidance since the beginning of this academic year. And I can't thank Dr. Dixon and her team enough for stepping ahead and doing that. So kudos to you. But schools cannot do this alone, and that's why we're all here. They need all of us to help them, to help our community, to get our numbers down in our community. And so it's not just the schools, it's not just the teachers, it's not just the students. We all need to mask when we're indoors in public places. We all need to get vaccinated if we're eligible and get boosted if we're eligible. And we all need. That's how we keep our schools in session, that's how we keep our economy going, and that's how we get to the other side of this pandemic. Columbus Public Health continues to give COVID vaccines. We're providing a clinic today, right upstairs behind me. We're here until 6 p.m. tonight. And tomorrow, as well as Thursday, we are going back to the Celeste Center to offer COVID-19 vaccines, first dose, second dose, booster, pediatric dose, flu vaccine. Any vaccine you want for COVID or flu will be available at the Celeste Center Wednesday and Thursday of this week. And we will be there from 9 to 6 p.m. In addition to that, we offer 9 vaccine clinics throughout the week, whether it's here, one of our rec centers that we've partnered with, or one of our community agencies. So COVID-19 vaccines are readily available in our community. You do not need an appointment. You do not need to pay for them. They are free, and you can walk into any of the Columbus Public Health vaccine clinics and get your vaccine. So that is not an excuse for someone not getting vaccinated. Vaccines, as you know, now are available to anyone who's 5 years of age and older. And then boosters are also available for many. We have partnered with Columbus City Schools. We have gone into the schools and provided the vaccine to the elementary kids, to the middle school kids, and to the high school kids. And so that has been a great partnership and a great success story. So we have made this available and will continue to make this vaccine available for all who are eligible. Columbus Public Health will continue to do our part. But I challenge everyone who's listening, we need you to do your part. And your part, again, includes masking, vaccinating, keeping your distance, and staying home when you're sick. So please, please join us. Get vaccinated, wear the mask, stay home if you're sick, wash your hands. And please help us help Columbus City Schools so they can keep our kids, yes, they're our kids, they're our community members, they're the future leaders of our community. We want them to go to school, to get educated, to be healthy, and to be safe. And they can do that best in the classroom where they belong. So with that, I'd like to pass this over to Council President Hardin, and I thank you all for your attention.
Thank you, Dr. Roberts. Thank you for hosting us, and thank you to you, your team, and all of those who have been working for 2 years straight to keep our communities safe. I want to say thank you to the mayor for pulling together this partnership, the power of one that School Board Member Cole talked about. And really, we come together to, one, say thank you. Thank you to the leadership of Columbus City Schools. Thank you to the bus drivers. Thank you to the teachers. Thank you to the parents. This is hard. This has been hard, but we are getting through it. Secondly, I want to say that just like we were 2 years ago when we realized that the safest thing for our kids to do were to close schools, we listened to the science, and it was a tough thing to do, but we followed the science and we did that. Fast forward 2 years now, knowing what we know now, having the mitigation tools that we have now, the science is saying that the safest place for you and our children to be is in schools. And so just like we had to follow the science at the beginning of this thing, it is that crucial that we follow the science today. I can't give you a better public health advice than Dr. Roberts, or give you our community better insight into what's happening in our schools than Dr. Dixon. But I can say this clearly, that schools should remain open, and we're going to get through this. Early hotspots like New York City are now seeing declining positivity rates and overall case counts. And this doesn't mean that folks in New York or folks right in here in Columbus can relax. It's the opposite. We have to continue to do the things that work: the face mask, the vaccinations, the social distancing when we can. But our community will get through this, and we will get through this together. To wrap up, just have a couple asks. First, to Central Ohio communities, Columbus has a mask mandate for public spaces. If you're a city council member or a city manager in Central Ohio, please put a mask mandate in place. We know this works. It keeps us safe. It keeps our economy open. We know that residents don't just stay in Columbus. Folks may live in Columbus, work in Upper Arlington, and have their kids in schools or in daycare in Hilliard. Good quality masks work, and we as a community leaders need to encourage mask wearing. Next, for individuals, if you can afford it, get a high quality mask like the N95 or a KN95. These will dramatically reduce the spread of COVID compared to both cloth masks, or even worse, people going maskless altogether. Second, I think this is the most important thing, if you are eligible, please get vaccinated. Dr. Roberts just said this, and eligibility is 5 and older in the city of, in our community. Please get vaccinated. We're making every opportunity available so that you can do so. Again, we're so appreciative to the folks who are working to keep us safe. We can fight this thing, and we can do it together. With that, I'd like to invite up my friend and the president of the Franklin County Commission, Commissioner Erica Crawley.
Thank you, President Hardin. I want to say thank you, like my other colleagues, to the mayor for bringing us together. Thank you, Dr. Roberts, for continuing to lead us through this pandemic safely. Thank you, Dr. Dixon and Board Member Cole, for your leadership. We know that you have tough decisions to make, and it's not easy, but you make them anyways, in keeping our children and our community at the forefront. Thank you, Mr. Clark, for your perspective, and of course, President Hardin, for your ongoing leadership. And I'll introduce my friend Kenny McDonald in a second to talk about his commitment from the business leadership perspective. But I just want to say what you continue to hear throughout this press conference is that we want our children to thrive. That is our number one priority. And I want to say thank you to the teachers, to our service, our food service workers, to our bus drivers. As the mayor said, we appreciate you, we support you, and we know that it's hard to go into the classroom and deal with this pandemic, but we don't always have to like a decision for it to be the right one. And so I just want to say thank you to everyone for being here this morning and being willing to continue these conversations and talk about these important issues and the responsibility that we have for caring for and educating our children and youth. There is no doubt that the pandemic has been incredibly difficult on our young people. We have heard from the students. I am a mother of twin girls, have navigated this pandemic with them at home and now in the classroom, back in the classroom, and I get that it is difficult, not just mentally, but emotionally and socially. It is hard. From the disruption of normal educational growth to social isolation from their peers, our kids have been one of the most impacted groups, especially our kids who are already facing economic and social disadvantages. COVID cases continue to rise in Franklin County, and my colleagues and I at the Board of Commissioners have taken this situation seriously. We continue to fully support Franklin County and Columbus Public Health, as well as the other health professionals by following and funding the latest health guidelines and recommendations. Because of this, we know that rigorous masking and testing procedures, as you continue to hear, as well as continuing to encourage vaccination, truly works to help our schools function as normally as possible in this pandemic, because normal is not the same as the normal we used to know. But we want to keep our children safe and in the classroom. As a mother and an advocate, it is my highest priority to keep our children safe and to listen to their caretakers. I sincerely appreciate those who have spoken up to voice their opinions about what they feel is best for our kids. It is not lost on us at all that we have different perspectives and opinions and that they are of all value. I believe it is in our students' best interest to keep them in an engaging and stable classroom environment with in-person learning. We know how difficult the past 2 years have been and how it has created hardships for many of our children, families, and residents. However, our community will continue working to get through this difficult period together. As Board Member Cole said, the power of one. Now, I would like to introduce my friend, Kenny McDonald, CEO of Columbus Partnership.
Good morning. I just want to thank the mayor and this group of elected officials and all that they represent, our public health officials, the hundreds of school officials that keep us moving forward every day, and especially want to express my gratitude for the working parents of this community. They get up and do a dance every day. We used to have snow days, and that was a struggle enough, and now we have all this. So please accept the business community's deep gratitude for this issue. The past 2 years have reinforced the centrality of schools to our community and to our society, and then finally to a functioning economy. And never have we maybe understood that to the depths that we do today. Labor force participation has been a huge challenge. It's a challenge to keep restaurants open, supply chains working, and honestly our cities functioning because of this labor force participation that continues to dwindle. Let me make a fine point about that the people who've been affected the most are working parents and especially working women who've had the biggest challenge of re-entering our workforce. Keeping our schools open is central to solving that problem over the long term. When schools close, incomes are lost, wages are lost, Small businesses are closed or even put in peril of closing permanently. Our supply chains are disrupted, and the shelves of our stores, when we go to get something, aren't there when we need it the most. And finally, let me say that the lost academic time for our kids is critical. Our kids are the future workforce, and any lost academic time in this great area, this region of opportunity, is critical, and we're going to have a hard time recovering it. So staying steadfast about keeping schools open, moving forward, has never been more important in a community that is growing and thriving. Our open schools will help us recover or keep our small businesses open, and we look forward to working with all of these officials, this coalition, as we navigate the coming months and perhaps even years. As the mayor said, we will be living with this or some version of it for some time, and we'll have to continue to have this conversation. Please do all you can to be healthy and safe, and let's keep moving forward. I will turn it back over to the mayor. Thank you.
Thank you, Kenny, and thank you for all of our speakers here today. And again, we know from a public health standpoint, from a community standpoint, that the safest and healthiest place for our young people to be is in the classroom with teachers, with all the mitigation efforts that have been put in place by Dr. Dixon and her team under the advisement and guidance of Dr. Roberts and her team. These things are absolutely critical. And again, regardless of where you stand on any number of issues and worldviews, we know we all share these three things in common. Keep our schools open, keep our economy going and growing, and making sure that our health systems are able to care for our neighbors when they need it the most. We'll be happy to take any questions. Good morning, Kevin.
Good morning, Mayor. The teachers union doesn't share your opinion. 2,000 some odd teachers have said they'd like a 2-week pause. There seems to be an impasse between what you're saying and what the teachers are saying. How do we resolve that?
Well, I'll let Dr. Dixon speak to this as well. I don't think there's really an impasse. I mean, we love and support our teachers, and that's why we all advocated to the governor, all of us here today, that they move to the front of the line, quite honestly, in front of police officers and firefighters to get the vaccine so we could reopen our schools safely. We believe the mitigation efforts that are being implemented by the district under the advice of public health experts make our classrooms safe. And so if there are things, and I think there's some things that have been shared by the CEA with the district. I know Dr. Dixon and her team continue to work on those things, but we believe with the mitigation efforts based on the science, based on what's in the best interest of children, that in-person instruction are the most important. Dr. Dixon?
Thank you, and I agree. We understand that there are concerns for many people, and we have those mitigation strategies in place. And as Dr. Roberts and others have stated, this virus will be here. And so we believe that in-school person is the safest place for our students, and we will continue to advocate for that. We have the mitigation strategies in place. We've addressed the multiple issues from various team members, and we will continue to work together to make sure that if it's any other thing that we need to address or correct, we would continue to do that. But right now, we know, and this data that I've gave you earlier states that we've had over 100 schools in person learning at 100 schools. And so we believe that's the best place for our students. We know that is it perfect? No, we're not in a perfect world, right? But we're going to continue to make sure that we advocate on the behalf of our students, make sure that our classrooms are safe for our teachers and our students and our parents. So we will continue to work together.
How do you plan on convincing those members of the union that it is a safe place to them if they don't believe it is?
We will continue to make sure that we have our mitigation strategies in place. We will continue to make sure that we're addressing any of the concerns from any member of our organization, and we will continue to work together to make sure that students are in class and in-person learning is prioritized. That's where it should be, and our teachers are making sure that that happens. Our students need them, and we know that in-person learning is best for our students. So again, as I stated, if there's anything that we need to continue to address, I stated earlier that we were providing additional PPE where needed and were requested. We just deployed 2 weeks ago 45,000 KN90 and KN95 masks for our teachers. Anything that our teachers need, we're providing it, along with our school nurses. Our school nurses have been instrumental in making sure that we keep our classrooms open. And so we all have to work together. We're a large organization, over 9,000 employees, serving over 20,000 plus families. So we understand that our organization is large. We have issues that we have to address. We address those issues quickly as possible, but we make sure that our students are learning in safe environments and our teachers have everything that they need to make sure that their environments are conducive to learning.
Yes.
Dr. Dixon, sorry.
Go ahead.
Dr. Dixon, how confident are you in staffing levels coming up here? I know that students are not in the classroom today, but teachers are with their PDE day and their day tomorrow as well. Have you been tracking attendance this week as well for teachers?
Yes, no, I don't have those numbers. I get those at the end of the day. But again, yes, we have professional development today. We have records day tomorrow. And again, we know that this is all not just COVID related. We know teachers have other health issues. And you know, people are off for various reasons, but we're keeping track. We have lots of permanent substitutes in our buildings, people who have stepped up and said they were continue to teach if possible, if needed rather. And we also have teachers who are covering classes for their colleagues. So when we talk about a organization that supports one another, so we understand that we want our kids in our classrooms, so our teachers are stepping up and say, I will cover that class until we get a substitute in. So, you know, it varies from day to day. That's why we have, you know, some days we have schools open and some days we have to move students to remote learning, but it varies, and we would continue to use that strategy so that we can keep as many schools open as possible.
You said that there are teachers covering for other teachers' classes. Is there anything being done to help them through this stressful time? Any extra things that the district is doing to provide them with help during this time?
Oh, absolutely. I mean, it comes from our amazing principals, right? So we have amazing principals that are making sure that whatever additional support that those substitutes need. And these are building subs, because these are educators who wanted to be in these buildings permanently. They wanted to work with our students, and they have worked with their colleagues, so they know what the lesson plans are. They know what our students need. And again, we talked about earlier, as Board Member Cole talked about our Power of One initiative. That's the power of it. You know, we are working together to make sure that our students are learning in person, our teachers have the resources they need, the support they need, and we're making sure our principals and other central office staff are providing that support.
Dr. Dixon, the vaccine has been mentioned as something that's key to stopping the spread of COVID or slowing down the spread of COVID. Is the district considering mandating the vaccine for staff?
Mandating the vaccine for staff, is that the question? We've not made a decision on that. So currently, it is not a condition of employment, but we have partnered with Columbus Public Health to make sure that the vaccine is available for all of our staff members. So we want our staff members to have the vaccine, to be boosted. It is their choice currently, but we have encouraged it, and we're hopeful that everyone decides that it's best for them to get that vaccine.
Do you know how many percentage of the staff is vaccinated?
I don't have that information because, again, it's not a condition of employment.
We have a question.
I have a question. Dr. Dixon, just to kind of go follow up on some of the questions in regards to teachers and subs, are you seeing any shortages? Do you have enough subs at this point? I know a lot of districts are trying to hire.
I think everyone across the United States is seeing subs and shortages in all of our staff, and we're no different, right? But people were working together and to make sure that if we need to cover classes, we'll cover classes. And that's what we continue to do. So we stated earlier that we had a shortage in our bus drivers. We have decided to offer courses through our adult ed program. We are providing free courses and some financial incentives for those who want to be trained and get your CDL. So if any of you out here want to come and work for our transportation department, we need additional bus drivers. And that's what we're going to continue to do. We're going to continue to recruit employees for our district, and we're going to continue to advocate for those who want to be substitutes.
Financial offering subs or transportation more money, is that coming from the pandemic funding that was from the government, or where are some of those financial resources coming from?
Yeah, that's a great question. So we have many sources. So we do have additional ESSER dollars that we can offer stipends and increase. But in some sense, we've just, the board has decided that this is just the right thing to do. We should increase our wages. So we want to be competitive. So competitive wages is what we've been able to offer. For example, our teacher now would be able to receive 250 hours in our Power On initiative. And it's an initiative so that classified and certified staff members are able to come up with strategies to connect with our students. Because we know that our students are not as connected with us as they were prior to the pandemic. And so these hours, these dollars would be coming from our ESSER dollars. But we wanted to make sure our staffing salaries were competitive, and that's something that the board had adopted prior, and those are not being used with federal dollars.
Just a larger call out to the community. I mean, this isn't just the district or the superintendent's job to deal with these issues. So if you're eligible to be a substitute within Columbus City Schools, we need you. And we need you to step up to help our community during this difficult time. If you have a CDL or are interested in earning your CDL, our kids need you, and I'm asking you to step up. And to our parents, as the father of an 11-year-old, who I think has conversations about these just about every day. Our staff, our teachers, the administrators need your help. We need you to talk to your kiddos about the importance of wearing these masks all day while they're at school, unless they're actively eating and drinking. We need parents to step up as well. But if there are any other questions, I want to thank everybody for being here today. We'll have folks stick around if you all want to do any one-on-ones. Thanks, everybody.